and some of the problems, diseases of adaptation that you can have because of stress. And the reality is, there's a lot of diseases out there. There's a lot of conditions, but a lot of them have to do with the fact that you're overly stressed. It isn't the fact that even colds. A lot of times you fight off the cold. You fight off the cold. Something mean happens to you, and then all of a sudden you come down with a cold. Now, why is that? And that's what we're going to talk about today. So let's go ahead and get started. Maybe. There we are. We're at the end. Stress and stress-related disorders. Strangely enough, this happens a lot in medicine. I started recognizing this when I first started working in medicine. Um, People that were under a lot of stress. Um, Somebody has a fight with their spouse. All of a sudden, they come down with asthma or something, or headaches or migraines. That kind of stuff. Really kind of interesting, and I've got a bunch of stories. I got a bunch of stories. Some of them are about myself. So the connection between the health of the body and the attitude of the mind has been pondered for centuries. Rene Descartes believed that the body and the mind were separate dualism, but now we know that what affects one affects the other. What affects the brain, how you're thinking affects what happens to your body. And we've even gone farther than that. We know that the biome is there, and the biome, or the bacteria that maintain your body, they are the ones that break down foods in your stomach and your intestinal tract. And we know that those biomes have a lot to do with the way that you react to things, as weird as that sounds. So if you live in one part of the world, you have a different one biome, and if you live in another part of the world, you have another biome. Now the strange thing is that if I move my biome from where I am today to someplace else, say the high desert of the Four Corners area of Arizona, it's going to change, and it's going to change the way that I think. The foods will be different. The temperature will be different. My exercise level will be different. A lot of things are different. And because of that, of course, I will be different. Scientists who study the psychological factors that play a role in physical health are called health psychologists. And I've taught this class. Dr. Russ is teaching it right now. But health psychology is really fascinating, especially with my medical background. I had no problems with seeing how one thing affected the other. The leading psychological factor in physical health is stress. A stressor refers to any challenge and demand that placed upon an organism. The physical and behavioral effects that a stressor produces are referred to as the stress response. How do you respond to stress? And not everybody responds the same to stress. My favorite example of that is emergency room doctors. A lot of people want to be emergency room doctors. There's a lot of people that can't be emergency room doctors, no matter how much they want to be an emergency room doctor. And the reason is because they don't handle surprises very well. They don't handle stress very well. Some people handle stress really, really well, but they're not sensitive enough. They're not sensitive enough to people when they have problems, and they don't make good emergency room doctors. A good emergency room doctor is somebody who can listen to your problems and try to find a solution to it. But he's also they are also an individual that can handle one emergency right after the other. These mystery emergencies that happen one after the other. And the reality is, and we run into this all the time, um, people don't give you the entire story. They never give you the entire story. So you have to fill it in yourself. And hopefully, if you're good at it, you can fill in the right story. Otherwise, you really don't have a clue what's going on because they only gave you a little pieces of the story. Adjustment disorders are not extreme and usually last less than 6 months. It is normal to react negatively to negative life events such as death and divorce. When normal functioning is abbreviated, it is an adjustment disorder. Now, this is really weird because I've had adjustment disorders. I've been married 3 times, which means I've been divorced at least twice. I've lost both of my parents. I lost a sister. Death doesn't bother me because I've been around a lot of death, working in medicine for 30 years. That doesn't bother me. What bothers me the most, what is most stressful to me, and this may seem strange to you, is losing my job. Every time I lose a job, I have an adjustment disorder. And it's weird. It's really, really weird. Sources of stress, tests in school, of course, relationship problems, death of a loved one, divorce, job termination, traffic jams, extreme temperatures or noise, which is one of the reasons why, well, I'm living in Iowa where it's fairly temperate. It's also green. Uh, one of my real complaints about living in Saline and being in Chinle, driving to Chinle and whatnot, is the fact that it's high desert and it's brown. I've lived in brown before. Didn't enjoy it very much, um, but I grew up around green. Where I grew up was a oak forest. It was a swamp. It was green. It was farmland. It was Indiana farmland, and that's what I crave, oddly enough. An adjustment disorder is a maladaptive reaction to an identified stressor. This maladaptation leads to problems in the following areas of function: social, occupational, academic functioning. The problem also causes emotional distress that is greater than that normally seen with this stressor, and these are adjustment disorders. Psychoneuroimmunology studies the relationship between the psychological system, the nervous system, and the body's immune system. The body's reaction to stress involves the response of the endocrine system. The body responds to stress by activating the endocrine system. The hypothalamus reacts to stress by producing corticotropin releasing hormone, or CRH, that stimulates the pituitary gland to produce adrenocorticotropic hormone, or ACTH. ACTH stimulates the outer layer of the adrenal glands, the adrenal cortex, to release the corticosteroids, cortisone, and cortisol. Steroids boost resistance by fostering muscle development, building immune responses, and releasing sugar from the liver. From the inner layer of the adrenal glands, the adrenal medulla, come the catecholamines, epinephrine and norepinephrine. These hormones accelerate your heart rate and stimulate the liver to release stored glucose. The primary structure of the immune system are the leukocytes. Leukocytes come in 5 structures. They come in neutrophils, and these are the neutrophils right here. This is a neutrophil, and that's a neutrophil. This is an abnormal form. This is an immature form. This is what they normally look like. And the reason I know that is because I was a laboratory technician, and one of the jobs that I really enjoyed was doing a CBC. And when you do a CBC, you pick 100 leukocytes randomly, and you identify them. And so you have to be able to identify them. And I can identify this as a neutrophil and that as an immature neutrophil. And the reason these are there are because of bacteria. Now, normally, if you're wandering around the world, you run into a lot of bacteria. Normally, you don't run into a whole lot of viruses. Viruses come from people. Viruses come from animals. They don't come from nature. But bacteria, there's bacteria everywhere. There's bacteria on your pencil. There's bacteria on your computer. There's bacteria on your skin. And sometimes these will get into your system and you'll have to destroy them. And that's what the neutrophil is for. It's for destroying bacteria. What else can I say about this? I was going to say something else. Oh, the majority of white cells that you will see in a normal CBC, if you're not sick, will be neutrophils. Now, if you have a bacterial infection, like you cut yourself and you've got a staph infection or a strep infection, or if you have an appendicitis, you're going to have an excess number of neutrophils. And that's one of the ways that we can diagnose that you have an appendicitis or that you have an infection. We see an excess number of neutrophils. And we'll also see abnormal forms like this because your body is trying to destroy that bacteria. And the way that it's trying to do that, it's also trying to keep it out of your blood. It really needs because if it gets into your blood, then you have what is called septicemia, which is a blood infection, and now we got a really serious problem. So the neutrophils are trying to keep it out of your blood, and it's also trying to defeat the bacteria wherever it is, probably on the surface of a cut on your skin or whatever, or an appendicitis. And in that case, we'll see a lot of these guys. The bacteria or the leukocyte that fights lymphocytes, the fight the leukocyte that fights viruses are lymphocytes, and these are lymphocytes. Most of the illnesses that you know of, mumps, measles, chickenpox, coronavirus, these are all viruses, of course. Almost all your colds are viruses. Sinus infection tends to be a bacteria, but all the other diseases you get are viruses, and this is a lymphocyte right here, and that will be what you will see an excess number of if you have a viral infection. Eosinophils fight allergens. This is an eosinophil. The reason it's called eosinophil is because it picks up the dye eosin, and eosin is orange, and that's one of the reasons why the cytoplasm is orange. Eosinophil. It fights allergens. It also fights parasites. So if you have a roundworm, or you pick up pinworms, or what's another parasite that you could pick up. Once upon a time, I was in Guatemala and I picked up Cyclospora, which is a parasite. And when they looked at my blood, they saw all these eosinophils. Okay, and the fourth type is basophil. Basophils fight heavy metals. They are phagocytic, and this is a basophil. The reason they call it a basophil is because it picks up the basic dye, which is purple, and that's it right there, basophil. So when you see these, you don't see very many of these guys right here. See a lot of these guys, a lot of these guys, but not very many basophils, not very many eosinophils. Gets kind of exciting when you actually see an eosinophil or a basophil. And the last type are monocytes. Monocytes are also phagocytic. In other words, they engulf things, and they're fairly large cells, and that's what they look like. Now, the strange thing is a lymphocyte, when it is immature, it'll look very similar to this. Not quite as large, but it looks very similar to that. Anyway, not important. So as a laboratory technician and a hematologist, one of the things that I did was identify all of the different types of leukocyte. Leukocytes recognize pathogens because of a protein on the surface of the pathogen called an antigen. The leukocytes will produce a corresponding antibody that attaches to the antigen for destruction. The lymphocytes that attach the antibody are called T cells, as interesting as that is. And these are neutrophils that have engulfed bacteria. And the bacteria that these guys have engulfed are gonorrhea. One of my jobs when I was in the military was identifying gonorrhea infections. And what you would do, you'd find they would give you a specimen of pus, and you would look at it under the microscope. You would stain it, and you look at it under the microscope. And this is if they had gonorrhea. This is what it looked like. As you can see, these are the bacteria. These little guys right here are bacteria. Inter and extracellular diplococci, and as you can see, they're mostly in pairs. They're mostly in pairs. So that's what you're looking for with gonorrhea. Anyway, the T cells attach the antigen, the antibody to the antigen, and then they are destroyed. The general adaptation syndrome was developed by Hans Selye. The syndrome consists of 3 stages after the stressor triggers a response. The alarm reaction, the body prepares for fight or flight. If the stressor isn't relieved, the body goes into the reaction stage where the body tries to conserve its resources. And the final stage is the exhaustion stage where the body shuts down. And there you go. And this is not where you want to be. You don't want to be exhausted because this point can sometimes lead to death. This is where we normally hit a serious problem. The alarm reaction, our body reacts to it. We get to a point where we're moving kind of pretty good, and then all of a sudden, if it doesn't go away, then we start to move into the exhaustion stage. And if we don't back off, then potentially we can exhaust ourselves to death. General adaptation syndrome. There you go. And that's the way it works. And if you've ever been under a great deal of stress for an extended length of time, hopefully this is where you stopped. Because if you didn't stop until here, it probably took you a while to recover, and that's death. So I'm sure that didn't happen. During the exhaustion stage, the parasympathetic branch of the autonomic nervous system takes over and the body decelerates its response. If the stressor persists, the individual might develop a disease of adaptation. And this is even at this stage, you can develop a disease of adaptation. Disease of adaptation can take any form, usually in a weakened organ or system. And this is really kind of interesting because this has happened to me. When I was in college, I was married, I had a child, I was running track. I was also trying to get a teaching license. So one day, all of these stressors came together. My wife decided that she wanted to leave me. I wasn't paying enough attention to her because I was concentrating on getting through my teaching program. I was student teaching. I was running track every evening because I was trying to be a good track man. And so one weekend she decides she's going to leave me, and so we argued all weekend. And finally on Sunday, we loaded up the car to take her home, which was on the other side of the state. We were in Indiana, and we got about halfway, and then she changed her mind. So we came back, unloaded the car. By that time, it was late in the evening. We hadn't eaten. Who wanted to eat because we were both, stressed out because of all the arguing all weekend. So the next morning, I had to get up and go to school and student teach in the morning, 8 o'clock in the morning. I student taught until noon. At noon, I went home. I went back to school. I went to class. I had 2 classes that afternoon. And then I had to get dressed for the track meet. So then we were running, and we were running against Butler University. And so so the track meet started, and usually I ran 4 races. I ran the 440-yard dash, the 400-meter relay, or I'm sorry, the 440-yard relay, the 440 or the 220-yard dash, and then the mile relay. And so I think the first race was a 440 yard relay. We won that race. And then the next race was a 440, and I came in third. Normally I won the 440, and here I came in third. But then I started vomiting after the 440, and then I ran the 220. I came in third. I normally won the 220, and after that I just couldn't stop vomiting. And then I couldn't run the mile relay. I just didn't have anything. My back hurt. It was so weird. So after the track meet, the coach was real worried about me because I didn't look very good. And so they took me to the hospital. It turned out that my kidneys had shut down. The reason my kidneys had shut down was because I was under so much stress that all that adrenaline that I had been pumping through my system since Friday, when my wife decided that I wasn't paying enough attention to her, all that adrenaline that had been pumping through my system shut my kidneys down. It didn't shut them down right away. It didn't. It started. It shut them down when after my first race, because there was just too much stress, and I'd been under too much stress for an extended length of time, and so I didn't have any kidney function. They took me to the hospital. I was in the hospital for a week. They figured out what had happened. And strangely enough, the same thing had happened to Joe Frazier. Joe Frazier had boxed against Muhammad Ali, the Thrilla in Manila, and same thing happened to him. That was so stressful, and the fight. He went 15 rounds. I went 15 rounds with my wife, but it was more arguing than punching. No punching, I can assure you, no punching. Anyway, he had what they referred to as athlete's kidney, and they diagnosed me with the same thing. So, and as it turns out, weak kidneys are something is kind of a family thing for my family. That's not the only time I had a disease of adaptation, but that was the first time my kidneys shut down. But since then, I haven't had any trouble with my kidneys. I can assure you. I've had kidney stones, but that's about it. No more malfunctioning kidneys. Corticosteroids only assist the immune system for a short period of time. What are we talking about? Diseases of adaptation. Diseases of adaptation can take any form, usually in a weakened organ or system, and the mine were my kidneys. Allergic reactions might be diseases of adaptation like asthma or hay fever. Heart disease might result from the stress that the individual experiences. And of course, that is where I am right now. Corticosteroids only assist the immune system for a short period of time. If the stressor persists, the corticosteroids will actually begin depleting the immune system rather than building it up. This occurs because the immune system does not have a chance to create antibodies since it is making white cells. It's making leukocytes. Psychological factors that moderate stress, self-efficacy expectancies, psychological hardiness, optimism, humor, social support, ethnic identity, all of these things can strengthen your immune system, as weird as that may seem. Why is that? Optimism, humor, social support, ethnic identity, because they're positive things. Acculturative stress, making it in America, acculturation, that's known as acculturation, psychological factors that moderate stress, styles of coping, emotion-focused coping, denying the stressor's existence, withdrawal from the situation, problem-focused coping, dealing with the problem. So there's a lot of ways to do it. You can deny that the stress is there. That's what I normally do. Or you can withdraw yourself from the situation. That's not a bad way to do it either. But if you can solve the problem, that takes care of everything. Theoretical perspective, people respond to stress in individual ways. This is known as individual response specificity. While migraine headaches are genetic, triggers may be general. Stress, such as bright lights, a change in barometric pressure can cause a migraine headache. Excess pollen can cause migraine headaches. Certain drugs that you take can cause it. MSG, monosodium glutamate, they used to use that to flavor Chinese food, but they stopped because there were too many people in the United States that were allergic to it. If you want to get MSG, you can go to Asia. You can get it in Japan, and you can certainly get it in China and Korea. Red wine sometimes will cause the same thing, and sometimes, well, red wine can cause people to have migraine headaches, as can hunger. A type A personality is a pattern of behaving involving competitiveness, aggressiveness, hostility, and time urgency. It's associated with a greater risk of coronary heart disease than the more relaxed, less hurried type B personality. And luckily, I'm a type B personality, otherwise, I'd probably be dead. Particular components of the type A pattern, especially anger and hostility, appear to be more directly related to coronary heart disease. And I do have coronary heart disease, but I'm not a type A. I'm a type B. But I allow myself to be in stressful situations a lot because I tend to be able to handle it. And the reason I am pretty sure I can is because I worked in medicine in the emergency room for such an extended length of time. A lot of people can't handle it, as I was explaining before. But I didn't seem to have any problem, and I enjoyed it. I enjoyed the rush. Cardiovascular disease, there's lots of them, lots of reasons for it. Arteriosclerosis is hardening of the arteries. Atherosclerosis is fat buildup in the arteries. A myocardial infarction is myocardial. Myo means muscle. Cardial means heart. That's heart muscle. Infarction means death. I do have a dead spot on the back of my heart from my heart attack. I had a heart attack in 19. When did I have a heart attack? Oh, 2010. I had a heart attack. And I'll explain to you in just a minute as to why. Type A behavior pattern is another reason for cardiovascular disease. And social environmental stress, marital stress increases recurrent cardiovascular disease by 3 times. And I've been married and divorced 3 times. I must be a dummy. Cardiovascular disease, ethnicity, African Americans suffer coronary heart disease at over twice the level of American Indians, Hispanics, and Asian Americans. White Americans have the second highest rate of cardiovascular disease. The anxious heart, anger and hostility and linking emotions and the heart, all of these things are reasons for people to die in their 40s and 50s of heart attacks. Oh. Hypertension in people 20 to 74 according to race and ethnicity. And there you go. African Americans have the highest. African Americans and white people, here we go. We're the ones that have the most problems, whether you're male or female. There you go. Coronary heart disease. Death rates in relation to race and ethnicity. There we go. Okay. And there you go. African Americans, whites, and there's the Hispanics and American Indians. Asian Pacific Islanders have the lowest. Asthma is an acute attack. Was I going to explain? Wait a minute. Okay. Yeah, I guess I need to explain my heart disease. Okay. We're talking about diseases of adaptation, and one of the problems that I've had in the past is I don't handle losing my job very well. I've changed jobs a lot because we moved a lot. We were military, and that's no problem. I can change jobs without any problem. It's when I get fired, or well, what just happened. The administration changes the rules, and all of a sudden, I can't work anymore. Not at Dene College, um, and that causes a problem. The first time when I had my heart attack in 2010 was right after I got fired from my job up in Montana, and that's when I had the heart attack. Uh, I lost the job. Uh, they closed the school. I was working at Ashford University in Clinton, Iowa, and they closed the school. And after that, just after they closed the school, I had two stents put in my heart that opened up the blood vessels in my heart. What's the third? Oh, when they decided, when the administration at Dene College decided that we had to come back, that was last summer, and they were telling us, well, we're gonna make you come back, and if you can't come back, then you have to resign. That became definite last summer, and last summer I had an episode where I got really dizzy, and I had to go into the hospital for a couple of days. There you go. Right after I determined that I wouldn't be able to work here at Dene College after the 2025, 2026, 2024, 2025. I'm working now, but this is it for me. I won't be able to work anymore for Dene College because I can't live at 7,000 feet. All right, now I'm at 700 feet with no problems whatsoever. But if I went to live in Saley again, because of my heart problems, I wouldn't be able to survive. Anyway, okay, so that's the situation, and those are all diseases of adaptation. Heart, my heart disease has to do with my circumstance. So anytime I lose a job, I have heart problems. And I don't know if that makes any sense to you. Sometimes it doesn't make sense to me, but this is just the way it works. You think this is a chronic illness, and you're going to have it, but usually you're okay, and then all of a sudden you're under a lot of stress, and by golly, it kicks in. And that's my heart disease, and that is my kidney problems from college. But I'm 75 years old, and as I keep telling you guys, life expectancy right now in the United States for a white male is 75, and I'm there. I'm right there, and I'm going to stay alive, and I'm definitely going to stay alive because I'm going to be at 700 feet rather than 7,000 feet. But all these problems, and we're going to talk about cancer and asthma. A lot of these problems are problems of adaptation. You get under a great deal of stress, and if you have a weakened organ system, like if you're a drinker, if you drink a lot of alcohol, then your weakened organ will be your liver, or if you're diabetic, your weakened organ is going to be your kidneys. Um, if you smoke tobacco or marijuana, your weakened organ system is going to be your lungs. So what's going to happen? Well, you're going to develop lung cancer if you smoke a lot of pot or smoke cigarettes. You get under stress, boom. Whatever's the weakest part is what reacts to the stress. Sorry, that's just the way it works. So, can you stop smoking and your lungs will repair themselves? Sure, that will happen. But if you get under stress again, guess what's going to happen? Your lungs are still your weakest part. It's not anything else. And that's where cancers, a lot of times that's where cancers come from. They're, they're diseases of adaptation. My sister, my, my sister's husband decided he would rather be female than male, and it really bothered her. And the next thing you know, she came down with cancer. Actually, first she came down with heart disease, and then they found the cancer. The heart disease was causing the cancer. The cancer was causing the heart disease, and eventually she died of the cancer. Um, whose fault is it? Well, she was the one that reacted, so I guess it was her fault. I was the one that reacted, so it's my fault. And now I'm not reacting to living in say Lee, and I'm going to survive for a long, long time. Asthma is an acute attack of breathlessness and wheezing caused by chronic airway inflammation with episodes of narrowing of the bronchioles. Two main types of asthma, intrinsic and extrinsic. Extrinsic asthma is caused by allergens such as pollen, dust, mites, mold, spores, animal fur, dander, and feathers produce sudden and severe bronchoconstriction that narrows the airways. That's extrinsic asthma. Intrinsic asthma, the less common form, has similar symptoms but is caused by stress or by frequent respiratory tract infections. Intrinsic asthma. A lot of times, intrinsic asthma is caused by your parents smoking. Asthma triggers pollen, mold spores, animal dander, cold, dry air, anger, laughing too hard, emotional stress. Treatment for asthma, bronchodilators, usually it has epinephrine in it. Anti-inflammatories such as steroids, such as prednisone, mast cell stabilizers, beta agonists, anticholinergics, muscle relaxation therapy, family conflict reduction. All of these things can reduce symptoms of asthma. Cancer, personality and stress, hopelessness and helplessness. I'm stronger than cancer. Psychological factors in treatment and recovery. These are psychological factors in physical disorders. Oh, they're psychological factors. We're talking about cancer. Um, so your personality can have a lot to do with whether you develop cancer, how much stress you're under. If you feel hopeful, then you'll survive it. If you feel helpless, then wow, the probabilities goes way down. Psychological factors in treatment and recovery, you got to have a fighting spirit. And this is one of the things I told you my sister died of cancer. One of her problems her whole life was the fact that she was sedentary. She didn't want to move. She hated her brothers because we made so much noise and we moved too much. Oh man. Anyway, so so my sister develops cancer, and I was living at the time. I was living out in California. We were stationed in California, so my parents would fly me out because my sister liked to argue with me, or I liked to argue with her. Anyway, we didn't really get along very well. So one of the things that they would do, they'd fly me out if she was getting a little bit low. It's not that she was happy to see me; it's that now she had somebody to yell at or to argue with or we just had an antagonistic relationship. And what they were trying to do is they were trying to get her to fight because her go-to model was to sit down and let it happen. And the only time she seemed to to get excited about anything was when she was arguing with me. So one of the things that they would do, they'd fly me out. Anytime she seemed very low, they would fly me out, and I would start talking to her. It didn't take us very long before we were arguing about something. It's not that we disagreed with things so much. It's just that both of us we were both really smart, and or at least I was as almost as smart as she was, and we could have long conversations. Her other brothers and sisters, they just agree with everything she said. Well, that doesn't work. I mean, that doesn't get your fighting spirit up. Anyway, they would fly me out. That's when I was in California. And then we moved to, where did we move to from California? To Washington, D.C. And I would drive over from time to time. And the crazy thing was, she had a house, and I had three brothers that were there, and they were just as physically able to do anything as I was, but they wouldn't do anything. They wouldn't come over and help her. They wouldn't wash her windows. They wouldn't mow her lawn. She had an old television antenna on her roof that she wanted taken out. She wanted the leaves cleaned out of her gutters, and they wouldn't do that. I never quite understood what was going on. Anyway, every time I came there, I became slave labor, which she thought was just great. Anyway, I probably kept her going a couple more months just by inciting her fighting spirit. And then we were up in California, in Montana, and I had a lot of friends that were healers, and she came out and she did things to help her heal, things that they told her to do, and that probably helped a little bit too. Anyway, acquired immune deficiency syndrome, AIDS. There's actually two of them. There's two types of AIDS. One is HIV. One is HTLV3, which was discovered by the French research, and then HIV, which is a human immunodeficiency virus, which was discovered in the United States. Adjustment of people with HIV and AIDS, psychological and psychopharmacological interventions, and now, of course, we have a way to prevent AIDS. It was really scary back in the 1980s. I was working in medicine in the 1980s, and before that, we didn't wear gloves. We cleaned things. We'd get blood all over our shirts, and nobody would care. It was open season on blood. But after AIDS, of course, we started wearing gloves, and if you got any blood on you, you had to change your clothes. It got a little strange. Anyway, DSM-5 bereavement, recognized in the DSM-5 as one of the other conditions that may be a focus of clinical attention, is bereavement. This is an adjustment disorder. It can cause post-traumatic stress disorder, reactive attachment disorder, and disinhibited social engagement disorder. It's listed in the DSM-4-TR under disorders usually first diagnosed in infancy, childhood, or adolescence, and these are the bereavement and adjustment disorders. Recognized in the DSM-5 not as a mental disorder, but as one of the other conditions that may be a focus of clinical attention, a category that includes several reactions and disturbances that can develop in the absence of any disorder. A normal stress reaction, considering the definition of normal for the individual in terms of psychological, social, and cultural background. The question is, how long should you bereave? How long should you feel bad about somebody dying? Should you feel bad for the rest of your life? how long? When should it go away? This feeling. I follow, and I don't follow very many people on YouTube, but one individual I do follow is a Texas girl that decided, a Texas lady, excuse me, Texas lady that decided that she was going to move up to Kansas and work on a farm with her boyfriend. And she started working on the farm, and she does a podcast twice a week. Now they've moved up to Idaho. They've gotten married. But one of the reasons that she was doing the podcast was to help her get over the fact that her husband had died. And then she met this other guy and she moved up to Kansas to work on the farm. But it's city girl becomes a farm girl. That's the title. But every year, at during the anniversary of his death, he died in 2021. Uh, she goes back to Texas to grieve and that's just wow, that's just too much. And I've been watching this and I've been thinking, lady, you got to get over this. This is not right. That's too much. You've been grieving way too long. This guy's been dead for 4 years. He died in an automobile accident. And she was pregnant at the time, lost her pregnancy, of course. And now she's married to this other guy. But I can't imagine what he feels like. Anyway, the whole point is that grieving should have a termination point. But prolonged bereavement is in the DSM-5 as an adjustment disorder. Adjustment disorders require an identifiable stressor that produces a maladaptive reaction within 3 months of the stressor onset. Bereavement is explicitly excluded from consideration as an adjustment disorder. I apologize. It's not an adjustment disorder. It's a grief disorder. This became a really hot point when they were trying to decide what to put in the DSM-5 as the DSM-4 and the DSM-4-TR. One of the things that they discovered after 9/11 was that like 2,500 people died during 9/11. Some of them are firemen, some of them were policemen. All those business people from that were in the Trade Center, the World Trade Center. All those people died. How did people react? Was there this mass grieving that took place? And the answer is no. The vast majority of people who were trying to grieve for the 2,500 individuals that died got over it within like 6 months, or didn't go into any depression at all, didn't have any reaction at all. Why? Well, humanity, if we reacted to death that way every time, we never would be able to survive. So no, we don't really react to death that way. We react to death in a more temperate way, or not at all. It's just the way things work. People live and then they die. Everybody dies, and that's one of the reasons why I didn't have any problems. When my mother died, she was 99 years old. When my dad died, he was 90 years old. When my sister died, she was only 59 years old when she died. I mean, that was more of a tragedy than my elderly parents dying. But, I've got to live the rest of my life. I can't, wander off to the cemetery every week or so and talk to my parents. Anyway, so what are we talking about? Time limited. The impairment or maladaptive reaction to the stressor is expected to remit within 6 months if the stressor is removed, and we're talking about adjustment disorder. Only the reactions that are in excess of normal reactions qualify to the diagnosis, and the dysfunction may manifest as depressed mood, anxiety, disturbance of conduct, or a combination of these symptoms. And I would say that the young lady that I was talking about before, who lost her husband 4 years ago and is still going back to Texas to be with his family on the day that he died, I would say that is adjustment disorder in her case. Um, it'll be interesting to see what kind of a podcast she has on Sunday, because she has one on Wednesday and she has one on Sunday. She's not going to have a Wednesday this week because she's down with his family in Texas, grieving. I mean, there are really great guys out there, but after they're gone. You can't just wishing this is going to bring them back. Anyway, adjustment disorders appear to be relatively common with prevalence rates between 5% and 20% in mental health outpatients and up to 50% in hospital psychiatric consultation settings. So there's a lot of people that do have a problem. Part of the problem is society tells us how long we can react to something, and if society thinks that's too long, if you've seen the movie Dances with Wolves, Kicking Bird, she was supposed to grieve for a select amount of time, and then she was supposed to do something else. She tried to commit suicide. Oh, he found her committing suicide. So she wasn't reacting correctly to what she was supposed to be doing. What are we talking about? We're talking about psychiatric hospitals. He found her and she had cut her wrist or something, and he brought her back to the encampment. That's how. That's why they allowed him to. That's one of the reasons. Who knows? It was a Kevin Costner movie from a long time ago. I haven't seen it for a while. It kind of it kind of hurts my feelings. uh, it probably did a lot of people. Anyway, so in mental hospitals and outpatient settings, there's a lot of individuals that seem to be having a problem getting over their grief. Among adults, suicide is a significant risk. It is possible that what appears to be an adjustment disorder is actually an early phase of or mild form of an emerging major disorder, and that's one of the reasons that we watch adjustment disorders so closely. Um, yeah, suicide is always a risk with an adjustment disorder. The DSM-5 provides similar diagnostic criteria for related diagnosis of acute stress disorder, except that symptoms are less than 1 month in duration. If the disturbance persists longer than that, the ASD diagnosis is changed to PTSD, post-traumatic stress disorder. Nearly all cases of PTSD will begin as ASD. Exceptions involve a particular qualifier of PTSD with delayed expression. PTSD can be diagnosed in some situations when the symptoms do not appear soon after the trauma, but much later, months or even years later. And of course, I had a PTSD reaction myself to some of the things that happened while I was in the military. I was fine, I was fine, I was fine. And then years later, I reacted to it. I won't tell you why. PTSD developed from effects of combat on soldiers. Now PTSD is more widely conceptualized than the original military focus. It was first developed as a diagnosis for people coming out of Vietnam. Incidence rates of PTSD approaching 1/3 to 1/2 of victims are found among rape survivors, military captives, political prisoners, and targets of genocide. About 1/2 of victims recover completely within 3 months. However, there is much variability in the course of PTSD, and a lot of times it has to do with your background, it has to do with your social connections, it has to do with just a ton of different things, how much support you're getting. And that's one of the reasons why I was fine, because I was in the military after this and I was getting all this support. And then eventually a trigger came up, and then I had a episode of PTSD. Minor tranquilizers such as benzodiazepines, which can impact sympathetic arousal, are not particularly effective as PTSD treatments. The tricyclic antidepressants and selective serotonin reuptake inhibitors, or SSRIs, such as Zoloft and Paxil, have received stronger support, with the latter being the current medications of choice for both ASD and PTSD. Discontinuation rates for pharmacological treatments are higher than those for CBT. What are we talking about? All right, let me tell you what happened. When I was in the service, one of the things that I had to do was cadaver recovery from airplane crashes. Normally, when an airplane crashes, it catches fire. So most of the cadavers that we were recovering were burned. Because of that, there's some people are sensitive to smells. Other people don't especially smell things. Um, when somebody gets burned, um, human flesh has a certain odor to it. Um, you add in the rubber and the plastic and the aluminum and that's it's just it's an interesting smell. It's a smell that you'll never smell in other situations. And that was my trauma, and I handled it fairly well because most of the recovery happened at the early part of my career. So and then I got out after 12, and then I was around military people. Uh, I was around my wife was in the military, so for the next 20 years or so, I'm around military people, and everything's fine because everybody has the same experiences. We've all had traumas, we've all dealt with them, and everything was fine. Everything was fine. Everything was fine. And then one of the things that happened when I came to Diné College was I was around mutton. I was around mutton, and I had never been around mutton before. Not really. Passing a Greek restaurant, sometimes you get a little whiff of cooking sheep or whatever. But around it today, it was a lot stronger because they were cooking it in the chow hall, in the cafeteria. You'd be driving from Saley to Chinle, and you'd pass somebody who was cooking mutton. I mean, it was there a lot, and that was a smell that reminded me of what I had experienced in the military, and that's another reason I'm a lot happier here than I was in Saley. And that's I've talked to other people about it, and they think that pork smells like what they smell. But then again, I had to be around these. I had to be around the cadavers for an extended length of time. And the other thing that happened was I had to draw blood from the cadavers. So I had to work with them, pull things off, and move things around, and I have a really sensitive sense of smell. Anyway, that's my PTSD. And while I was at Diné College, there were other individuals who were dealing with PTSD, and we dealt with it. We dealt with each of us dealt with it, and it helped the fact that other military people were there who had similar experiences, not exactly the same, certainly not the same, and we all helped each other deal with our own PTSD. Anyway, there you go. What are we talking about? DSM-5 new additions to trauma and stress-related disorders. 2 additional trauma and stress-related disorders result not from the intense trauma or the discrete stressors, but from a history of neglect and substandard care in children. Reactive attachment disorder was listed in the DSM-4. under a category known as disorders usually first diagnosed in infancy, childhood, or adolescence, but relocated to the stress-related disorders in the DSM-5 and expanded to include a second condition, disinhibited social engagement disorder. Children with reactive attachment disorder are presumed to have grossly disturbed internal working models of relationships that may lead to interpersonal and behavioral difficulties in later life, like anti-personality disorder. This is reactive attachment disorder. If they've never been around anybody that hugged them, they've never been around anybody that said that they love them, then potentially this is what you got. In DSM-4 parlance, this symptom presentation was considered the inhibited subtype of the reactive attachment disorder. This is a rare condition, but its prevalence in the general population is not known, and even in severely neglected children, it appears fairly uncommon, less than 10%. Reactive attachment disorder. Disinhibited social engagement disorder involves overly familiar behavior with relative strangers that violates the normal social boundaries of the culture. In other words, they come up and hug you. And this has happened to me a number of times. There was a lady that I used to work in a pediatrics clinic, and I was the one that drew people's blood. I was the lab tech. I was the guy drawing blood. And there was this one individual that came in. It was an adopted child, and this lady was just giddy because she was such an affectionate child. And it was really kind of interesting because she brought the kid in. I'd never seen. She was about 7 or 8 years old, and she brought her in, and I needed to draw her blood. So I drew her blood, and she didn't move. She just smiled through the whole thing. And she had a pretty good vein, and I got her without too much trouble. And she said it didn't hurt. And the ladies just, she's such a good girl. She just kept telling me what a wonderful child this was. And before the child left, she turned around and she ran into the laboratory and she started hugging me. And of course, she's only 7 or 8 years old. So, she didn't come up very high, and it was really awkward for me anyway. And she just said, "Oh, I just love you so much," which was really kind of weird because I hadn't really said that much to her and hadn't done anything except draw her blood. Really just bizarre. The child was suffering from disinhibited social engagement disorder. I was a relative stranger, and she gave me a hug. Um, it was just bizarre. And of course, the mother or the adoptive mother thought it was just the greatest thing in the whole wide world. That she's just the most affectionate child ever. She just loves everybody. And of course, as a psychologist, I saw it as something a little bit different. In the DSM-4, this pattern was listed as disinhibited type of reactive attachment disorder, but now we identify it as disinhibited social engagement disorder. These children are inadequately cautious in approaching unknown adults, showing indiscriminate sociability or a lack of selectivity in choice of attachment figures. As preschoolers, children with disinhibited social engagement disorder may continue to show indiscriminate familiarity with adults and peers. Some later receive comorbid diagnoses of attention deficit hyperactivity disorder, as well as cognitive and language delays. And that is it. So I'll talk to you again next week. Sorry that for all the disclosure. I've been under stress too. Anyway, okay. I'm fine. I'm still alive. I got a haircut. It's a little bit shorter. I have to go to Indiana this Thursday and Friday. I told you I ran track. Yeah, they're having a track dinner for all the old farts that used to run track. This should be interesting. You know, most of us are probably fat and feeble. I'll tell you if I'm the oldest one. I graduated in '71, so I'll tell you what happens. Anyway, we'll see you next week.